I'm Mark Spawn. When I say the words drug addict, who do you think of? A homeless person in an alley shooting heroin? Somebody smoking crack in a public bathroom? You might be surprised. Persons with addiction come from every demographic. They're young, they're old, they're students, stay-at-home moms, business professionals. And the substances they use include heroin, crack, fentanyl, synthetics, steroids, and prescription medications. Illicit drug use is a serious problem, and it affects all of us in ways you may have never thought of. Many of us know of someone who's been affected by addiction or have lost someone to addiction. This epidemic has created more awareness and empathy, but awareness and knowledge are just the beginning. We still have a long way to go. Here's something you may not know. The stigma of being a drug addict can be harmful. It's more than the old stereotype of the down-on-his-luck, living-on-the-street drug injector. Some drug users function very well in society. They're employed, blue-collar, white-collar, they're parents, they're students. But when it comes to being labeled a drug addict, that can cause alienation and embarrassment. They may fear the reaction of their family or their employer, and this fear can mean the difference between life and death. The stigma of being labeled an addict might also prevent someone from using a syringe exchange program or seeking help for an overdose for themselves or another, and it could stand in the way of their seeking out drug treatment. We need to understand that addiction is a medical condition, and people with addiction need to be treated with the same dignity and respect that we'd give to someone with cancer, diabetes, or a physical handicap. Early in my career, I would have been cynical about the concept of providing hypodermics to drug users, but for those who inject, getting and using sterile equipment is important. People who reuse needles or use dirty equipment are at risk of infection. They suffer abscesses and disease, and they can pass this on to their loved ones and others through intimate contact. There's also risk to first responders, the cop who does a pat-down search, the paramedic treating an unresponsive person, the booking officer at a lockup or jail searching clothing and personal effects. And when you think about the expense of treating persons with HIV, AIDS, or hepatitis, the costs soar. It makes sense financially as well as from a humanitarian perspective to provide injecting drug users with sterile equipment. New York State's Syringe Exchange Program and the Expanded Syringe Access Program get sterile syringes to injecting drug users to reduce the risk of disease, and they've had a dramatic impact on the spread of disease. You know, I've had the opportunity to visit syringe exchange programs here and abroad. I've talked with officers who have been stuck by dirty needles, and I found that these programs have helped users get off the street. They've reduced the number of discarded syringes in public places. They help protect first responders by decreasing the prevalence of dirty and reused needles. And they provide other services like medical consulting, food service, showers, laundry, and networking. And when a user is ready to quit, they're ready to help. We have to understand that even when users want to quit, they will struggle. Some will try several times before they can quit. Others may not be able to quit at all. When they can't do it, or while they're trying, ensuring their health and the health of our society requires that we look at new and innovative ways to eliminate or at least reduce the risks associated with drug use. We can improve the quality of life, not only for the drug user, but also for their intimate partners, family members, first responders, for society. We won't cure everyone. Some will succeed, some will fail, but we first have to realize that addiction is not a crime. We can truly help people who are struggling, by not marking them with a label or stereotype. I'm former Police Chief Mark Spawn. Thanks for joining me for What's Happening in Harm Reduction.